Hi, my name is Garrie Farrow, and I want to thank ATS for featuring my story in the Patient Voices Volume 12. I came to sarcoidosis through swollen feet and ankles. I now know that this is a benign sarcoidosis symptom. It took 4 years and 3 different primary care physicians to learn that this wasn't normal, that a Black woman in her early 30s, even with extra weight, shouldn't have swollen feet and ankles. A chest x-ray resulted in an appointment with a pulmonologist. After metastanoscopy with biopsy, I had my diagnosis of sarcoidosis of the lungs, stage 1. When I was first diagnosed, I was more concerned about survivability and got a little depressed because there wasn't much research about that aspect that I could find, but that was easily accessible. I wasn't quite sure what to expect. What was I supposed to be doing to deal with this rare disease? I was told that with stage 1 sarcoidosis, there was nothing for me to worry about, and sarcoidosis would have very little impact on my lungs, just to watch for long-term coughing or trouble breathing. Reading through some of the medical journals looking for information on sarcoidosis, I realized that the information that I was finding was not written for a patient. So I stopped researching and went back to my regular life. I already had thrombotic thrombocytopenia purpura, TTP, which I have since learned can be a symptom of splenic sarcoidosis. It was a tough pill to swallow that I would be lucky or unlucky enough to have not one, but 2 rare diseases. As I was undergoing my sarcoidosis journey, my sister Sharon sadly joined me on the trip. She had had breathing issues for years, so after my initial appointment with my sarcoidosis specialist, I'd call her and encourage her to talk to her primary care physician about her symptoms. Unfortunately, Sharon was diagnosed with sarcoidosis after a biopsy. She lived far away and was financially disadvantaged, which meant that she could not make the trip from her hometown to see my specialist. I gave her the best help that I could. We talked about my medication regime, and Sharon let me know that she was on prednisone. I let her know that I was on methotrexate and suggested that she discuss steroid alternatives with her physician. I don't know if her doctor didn't think medications other than steroids were an option for her, or if she didn't tell them about the medication, but she died in January 2019 from pulmonary sarcoidosis. Her lungs filled up with fluid, and they couldn't drain it from her fast enough. After my sister died, I became very angry and felt guilty. She was only 18 months older than me. Why was my sarcoidosis experience so drastically different? I decided I was going to find anything I could on sarcoidosis and dug through the scientific journals again. I found the Foundation for Sarcoidosis Research and joined their patient advisory committee. My hope is that all clinicians, not just sarcoidosis specialists, become educated on sarcoidosis and the impact it has on the entire body. Despite being an introvert, I felt the need to add my voice to others and joined their speakers bureau, as well as their Women of Color Patient Advisory Committee, and became a community leader for the University of Florida's Global Sarcoidosis Clinic Alliance. I wanted to get the word out about sarcoidosis. Helping others helps me to deal with the emotions that I've been compartmentalizing all these years. When something impacts your physical well-being, your emotions and your mental health are also impacted. A lot of the feelings that I've just been putting in a nice little box and just didn't address, but it does accumulate over the years. Opening myself up and the experiences that I've been through with this disease empowers me, and I hope the experience that I have been through with this disease uplifts others. What I hope to highlight is that this disease isn't centered on just one organ, and so having a central point of sarcoidosis care is important. Most patients experience one specialist at a time, and some may not find that one sarcoidosis specialist who helps them put it all together. I think it's urgent to establish a paradigm for multidisciplinary care in sarcoidosis. I have been fortunate to have a team of doctors actively working together on my health. I would meet with my rheumatologist and my sarcoidosis specialist, usually within an hour or two of each other. They collaborate on my treatment and speak with each other immediately before or after my appointments. That's the level of care that I hope all sarcoidosis patients can access, that I wish that my sister would have been able to receive. Thank you.